Lesson 231, Principles and Practice of Health Assessment. Session 1, Health and Nursing History. Welcome to the first session of our lesson on Principles and Practice of Health Assessment. There are 13 sessions in this course. Session 1 focuses on obtaining health history. We will explain what health history is, describe the structure of the health history, and the way in which the interview to obtain the health history is conducted. You are expected to watch the base video for each session to enable you build your competency. Nurses obtain information from clients during each encounter. The information they gather assists them in identifying the patient's needs, their strengths, their weaknesses. They identify their problems, and this helps them to plan the care appropriately and evaluate the interventions. In order to do this, the nurse must collect comprehensive information from the client and significant others. And this information needs to be collected systematically. So in this session, what we want to do is to give an explanation of the health history, the purpose of health history, components of health history, and how to conduct the interview when you are taking health history. So what is health history? Health history is a systematic collection of information from clients, family, and significant others. Information is also obtained based on the nurse's observation. Information provided by the client is subjective. Hence, the nurse makes judgment of the client's health problem and needs by validating the history through conducting physical assessments. Why do we conduct, or why do we need health history? We need health history because it gives us information on the baseline data of the client and the family health status. It also helps us in supplementing, confirming, or rejecting the data that we have received from the client. And also, health history helps us to identify problems and formulate nursing diagnosis that we use in planning our nursing care. When we collect health history, it helps us to make clinical decisions because the health status of our clients keep changing each time. So by collecting health history, you are able to obtain information from your patient to enable you know the changing health status so you can be able to manage your clients properly. If you collect health history, it also helps you to have a baseline for evaluating the outcome of care. We want to look at the components of health history. Information usually obtained when you are collecting health history covers a wide range of areas, but for this session, we'll focus on the biographic data, the chief complaint, history of present illness, past medical history, family history, including the genogram, which gives us the structure of the family, then the patterns of healthcare, as well as reviewing the body systems as part of obtaining health history. And we can also obtain health history in a narrative form or in a structured form. So this is our reading list. To make it easy, I want you to read Berkeley LS 2003, Base Guides to Physical Examination and History Taking, and read the pages 1 to 57 so you get information on the health history. So now let's take our first topic, which is the biographic data. So what information do we obtain when we are taking biographic data? Take note that the biographic data is also the same as the personal history. Others say demographic profile, whatever it is. They are the personal information that you obtain from the patient. And this information includes their name, their age, their address, marital status, occupation, religion, ethnic affiliation, etc. And you can report this history either in a narrative form, as you will see in the example 1 and 2, or in a structured form. So this is a type of structured biographic data. You can see the name, the dates of birth, age, and etc. And this information is in a structured form. Usually in the health institutions, there are forms that are made available for which you will complete the structured health history, and it provides information on all these biographic information. In the narrative history, you would give an account in a story form, as you can see on the slide. In this example, we give a narrative about Mr. S.A., who is a 40-year-old man, was born on the 25th of July 1968 at Lefi in the Volta region, and the rest continues. So the information is taken from the patient, but it is narrated instead of just listing it out. Another part of the information that we obtain is the chief complaint. And the chief complaint, you will find out exactly what the patient tells you brought him or her to the hospital. And according to Bates, you should state it the way the patient says it. You do not alter anything about it. So in this example, we say that Mr. S.A. complains of headache, fever, and loss of appetite for the past 4 days. That is exactly what the patient has told you, and that is what you write. History of present illness, you would obtain information, and that gives you a more detailed account about the chief complaint that the patient is reporting about. The difference between the chief complaint and the present history is that in the chief complaint, the patient just tells you, this is what is wrong with me. But with the present health illness, you, the nurse, have to obtain additional information about the patient's symptom that he or she is reporting. And you do that in a chronological form. So you note the onset of whatever problem the patient comes with. So if the patient say, I have headache, you ask the patient, when did the headache start? Where is it? You want to know whether the headache moves from one part to the other, or the headache is associated with other symptoms. So we call that a symptom analysis. So you need to find out the factors that are aggravating the problem, the severity, the quality, the timing, and associated problems that comes with a particular symptom. So if a patient is on any treatment, you also want to know the type of treatment, what the dose of the treatment, and also the routes and the frequency. Sometimes the patient is using other medications, herbal treatment, or any other therapy. You want to know whether these medications made the patient's symptoms feel better or worse as part of your symptom analysis. In your slides, you will find samples of the histories as they come along. I will not read all of them. I will encourage you to read the narrative histories yourself. Then the past health history. Here you will ask patients about events that have occurred in the past relating to his or her health status. And this information includes things like childhood illnesses, adult illnesses, mental problems, if any, if the person has had any injuries or accidents in the past, injuries such as falling. And then you also want to know whether he or she has been admitted previously to hospital. You are interested in previous surgeries, medications, and with the medications, you want to know whether they are prescribed medications or they are over-the-counter drugs. You also want to find out about the patient's allergy, whether he or she has had an immunization, the lifestyle, information on previous physical examination, and the number of partners and type. This is also a very sensitive information, and so you need to obtain it appropriately and without embarrassing your patient. You need to know the dates and the place that these events that the patients have mentioned. If the patient can recall, ask when these events occur. For instance, when were you immunized, at what age, what kind of immunizations have you had. You want to have specific dates wherever possible. There are some illnesses that have familiar that are familiar. So if one person has it, it's possible that another member of the family could have it, or they are genetical. So for this reason, we obtain information about previous illnesses that are common in the family. Then you want to find out if anybody has died, at what age the person died, what caused the death. You want to know if any member of the family uses substances such as alcohol and other drugs. Then it's important to find out history of illnesses such as mental challenges that may be prevalent in the family. And if you ask, you want to know which specific member of the family had the experience. So from the paternal side, maternal side, you want to know who in the family was affected. And to do this, the genogram is very useful in providing this information in a more structured form. And the genogram, let's take note that there are different types of genograms depending on the institution in which you are. Then let's look at the personal and social history. Here you are interested in information about the patient's interests, sources of support, coping styles, strengths and fears of the patient, educational background, and then the situation at home. How is the home situation? Are they living in a compound house, a shared compound, or they are living in their personal environment? It is very important to take note, because the home situation can have an influence on the patient's health status. And when you are discharging your patient back home, you want to be sure that the home situation is convenient for the patient to experience the appropriate rehabilitation. So it is very important to ask about the home situation. And you are also interested in the coping styles that the patients adapt. The sources of stress, you need to find out what kind of work the person is doing and whether that work is a source of stress to the patient. There are some important life experiences relating to their job, their finance, their retirement, leisure activities, and what have you. You need information about that. You also need to find out the religious affiliation and spiritual beliefs of your patient, because this is necessary in planning their care. You ask also about the activities of daily living, lifestyle that promotes health, including safety practices such as using seat belts, their diets, exercise habits, etc. They are all information that you obtain from your patient. When you have obtained all this information, you also would want to ask specific questions relating to the general health system of the patient. So you ask the patient about any changes in weight, weaknesses, and experience of fever over the past few weeks or periods before reporting to the clinic. You also ask about the presence of rashes, lumps, itching, dryness, and changes in color of the patient's skin, hair, and nails. In reviewing the head, you ask patients about headache, dizziness, lightheadedness, and injuries. The eyes, you ask about vision and the use of glasses and contact lenses, whether there is pain, redness, and excessive tearing. You ask about how the patient is able to see, whether there is double vision, whether the vision is blurred, or there are sometimes that they experience flashes of light. With the ears, you want to know if the patient can hear well or has any hearing problem, has pains in the ear, whether there are discharges, any previous ear infections, the experience of vertigo, tinnitus, and use of any hearing aid. You ask patients about all this to be sure that the ear is functioning normally. With the nose and sinuses, You want to ask patient whether he or she has experienced frequent colds, nasal stuffiness, discharge, itching, and then nose bleeding, or if he has been experiencing frequent sneezing. Also ask patients about any problems with the gums, the teeth, and whether the patient uses dentures. You would ask if the patient has had any problem with the tongue, dryness in the mouth, sore throat, hoarseness, and redness of the tonsils. With the neck, we are interested in any history about lumps, swollen glands, pain, stiffness, engorgement of the neck, and blood vessels. Ask patient if he has history of breast pain, rashes, discharges, and if the patient practices self-examination of the breast and how often he or she does that. Usually it is the female who would be encouraged to do breast examination, but recognize that breast problems could be prevalent in male as well, so you need to find out if they do that assessment as well. With the cardiovascular system, you want to find out if the patient regularly checks the blood pressure and have any idea about his blood pressure. You want to ask about chest pain, palpitation, and dyspnea, or what we call difficulty in breathing. The GIT, you ask about patient's ability to swallow, if he has heartburns, if he has good appetite or he has lost appetite, any experience of nausea, bowel pains, and if they has had any history of jaundice. With the urinary system, ask about frequency of urination and whether the patient urinates with force, pain, or if the patient has had any infections. If there is frequency of urination, which we call polyuria, or the patient urinates more often at night, which we call the nocturia. And then if there is any incontinence or retention of urine, or previous history of kidney problems, including kidney stones. With the genitals, you need to ask about any discharges, pain, masses, sore, change in color, and if they have experienced any changes in sexual patterns or sexual habits. In women, you want to ask about their menstrual cycle. With the peripheral vascular system, you ask if the patient has any history of varicose veins, cramps, or any problems associated with the peripheral vessels, such as capillary refill. With the musculoskeletal system, you ask about pain, stiffness, inflammation, swelling, weakness, and impaired mobility. Neurologic asks about fainting, blackouts, seizures, and weakness, paralysis, numbness, tingling, and tremors. Ask about history of anemia, bleeding, and if the patient has had transfusions in the past. If there was transfusion, has the patient had any reactions to the transfusion, you also want to know. You also obtain information relating to the endocrine problems, such as experience of heat or cold intolerance, excessive sweating, excessive thirst, hunger, change in shoe or glove size. These informations are key to making decisions about some presenting problems. Then you obtain information related to the psychiatric history of the patient, and you want to ask the patient if he has been experiencing nervousness, tension, mood changes, or hearing voices or seeing things that others do not see. So this is a sample of a report that you obtain if you do a review of systems of your patient. Now, having talked about the health history, know that there are several other aspects of health history, such as the developmental history, which we do not outline, and you can read about such. But for you to obtain history, you need to conduct an interview. And in conducting an interview, you need to make sure that before you talk to your patient to obtain information from your patient is comfortable and relaxed in a very good environment that is friendly. To ensure that there is a friendly environment, as a nurse, you need to introduce yourself to the patient and explain to the patient that you want to obtain information from him or her, so the patient will be relaxed. The patient should be comfortably seated. Use a language that the patient will be able to understand and appreciate. Speak in simple terms. And when you are inviting the patient's story, you need to use questions that are open-ended, preferably. But when you are obtaining structured history, then you will be asking close-ended questions for which the patient will give you response. You need to guide the patient by determining the kind of information that is needed. Sometimes you ask the patient, tell me about yourself and what brought you to the clinic. Then the patient starts telling the story. And as the patient tells the story, there are specific information that you require. So you need to ask probing questions so that you guide the patient's thought process. You also need to show empathy during the interview. Remember, you are talking to somebody who is ill, might be experiencing pain. And because of that, occasionally the pain would interrupt the interview process, and you need to sometimes break and provide a supportive environment for the patient to be able to continue to express themselves. So you need to show empathy and positive interactive environment. To enhance the communication process, make sure that sometimes you maintain silence so you can hear what the patient is saying. You listen attentively so that the patient knows that you are listening to him. Convey your acceptance by showing gestures that reflect that you are listening to your patient. Probe so that you can help clarify what the patient is saying. Occasionally, when you are not sure of what the patient is saying, paraphrase what the patient has said so that the patient will validate the information they have given you. For instance, the patient says that I've had pain since 3 days and the pain has been affecting my neck and it moves to my back. Now, the patient says the pain moves to my back. Which part of the back? You need to paraphrase again and ask the patient, do you mean that the pain that you feel, it starts in the neck and gets to the right side of the back, or it's at the whole back? For the patient to then try to rephrase what the patient has said so that you would understand and validate the information to be sure that you got the patient right. You also need to clarify the information so that you do not misunderstand what the patient is saying or represent the facts as the patient has mentioned to you. Sometimes the patient will say things that are misconception. During the interview, provide appropriate clarification without causing any anxiety, especially if it has got to do with cultural issues. Be culturally sensitive during the interview process without passing judgment on your patient. So in this session, we have looked at the nursing history. And nursing history is important to us because as nurses, we use the nursing process for giving our care. And the nursing process requires that we collect information in a systematic manner to help us identify the patient's problem and plan the care that we want to give, and at the same time evaluate it. An assessment is just the first step, and part of the assessment is to obtain the health history. And so we have looked at health history, what it is, and we have said that in obtaining health history, our interest and focus is to know who the patient is, what problem is the patient presenting with, and any background information that is relevant in helping us to make the right decisions about our patient's care. For our assignment, I want you to obtain a comprehensive health history from any client that you would encounter during your clinical schedules. Additionally, I want you to also find out information about how you will obtain information from patients who are anxious, patients who are depressed, patients who are aggressive and abusive, and clients who have seductive attitudes. There is a way to obtain information from these clients without being offensive and at the same time being supportive of the patient. So these are your references.